Okay, so in this video we're going to be looking at the relationship between the femur and the pelvis when we're talking about femoroacetabular impingement. So let's first do a refresher on the different types of lesions in the bone or the osseous lesions that could be related to FAI. One is going to be the pincer, where we actually have an overgrowth or an overhang of the superior aspect, if not also superior and anterior aspect of the acetabular rim. That's going to be your pincer, and then we move into the femur, and the femur we're going to have a cam lesion. It's best to get a visualization of where that cam lesion is in relationship to the femur by thinking about the image that we use to diagnose that, which is going to be that frog view where that person's leg is abducted externally rotated. And here, if I take this leg and I put it into that frog position, you'll see that the area of the neck that becomes most exposed if I was doing an x-ray this direction is going to be this superior and anterior aspect of the femur in that position. Now, that would indicate that I have an increase in the actual width of the neck in this area. So now that we've gone over those two different types of osseous anomalies that you can have in the hip that are related to femoroacetabular impingement, let's look at the positioning that would result in an approximation of the acetabular rim to this region of the femur. Now, if I go into a pure flexion, likely they're not going to run into each other. If I go into a pure abduction, unless it's a significantly large cam lesion, you're probably also not going to run into issues. But where I run into issues is going to be any flexion where I also have internal rotation. And you'll see that that'll actually approximate into the area where a cam lesion and a pincer lesion would be. So that's where you end up getting your impingement. Now that should look like or sound like a very familiar position of femoral adduction or flexion and internal rotation, because that is pretty much the bad positioning for most lower extremity problems, be it knee pain or hip pain. So I hope that clarifies a little bit with what happens osteokinematically when we look at FAI.